ready, Howard?
Yes, ma'am.
Let's go.
Right, good afternoon. I'm Mayor Eugene Foulcard, and this afternoon I'll be signing two proclamations, one for a proclamation on American Heart Month and also one for Children's Dental Health Month. So first I'll start with American Heart Month, and I'll read the proclamation because of the importance of it, and then once I finish the two proclamations, I'll turn it over to Dr. Wiltz. Whereas heart disease is a leading cause of death in the United States, claiming the lives of more than 650,000 people each year. During American Heart Month, we raise awareness of the risk of heart disease, remember those we have lost, and highlight the steps we can all take to save the lives of countless loved ones and address the unequal burden of heart disease in high-risk communities. Whereas through research and innovation, we have made considerable progress in recent years to advance our knowledge and treatment of heart disease. New technologies allow us to diagnose, prevent, and treat heart disease more rapidly and effectively than ever before. We also have a better understanding of heart disease risk factors such as high blood pressure, bad cholesterol, smoking, being overweight or obese, and type 2 diabetes. Whereas, despite the significant progress we have made, heart disease continues to exact a heartbreaking toll, a burden disproportionately carried by Black and Brown Americans, American Indians, and Alaska Natives, and people who live in rural communities. Cardiovascular diseases, including heart conditions and strokes, are a leading cause of pregnancy-related deaths, which are highest among women of color. Addressing these tragic disparities and improving heart health has never been more important, as people suffering from heart disease and related conditions are also at an increased risk of severe illness and long-term effects from COVID-19. Whereas engaging in regular physical activity, maintaining a healthy diet and weight, managing stress, avoiding smoke and vaping, and getting quality sleep each night can all reduce the risk of heart disease and help people live longer and healthier lives. While it is essential to see a healthcare professional if you have symptoms or risk factors related to heart disease, research shows taking a little time each day to promote a healthy lifestyle can improve your long-term health. Whereas on Friday, February 2nd, Wear Red Day, we honor those we have lost to heart disease and raise awareness of the actions we can all take to prevent it. I encourage all Americans to observe this important day. Continuing the fight against cardiovascular disease is crucial to improving our nation's public health. During American Heart Month, we must recommit ourselves to ensuring a healthier future for all Americans. Now, therefore, I, Eugene Foulcard, Mayor of the City of Franklin, do hereby proclaim February 2024 as American Heart Month in the City of Franklin, in witness whereof on the 5th day of February. I'll proceed to sign this proclamation for Heart Awareness Month.
All right, Mr. Mayor, if you won't mind indulging me,
Yes.
we have our dental, our staff dentist here.
Yes.
So I'm going to talk about heart awareness,
Yes.
and then we'll change places and get our dental team in
Okay,
here. We'll
all
do
right.
a tag team.
Okay,
Although
let's
this
do
is
it.
not the WWE, we'll just kind of do it that way.
Thank you, Doc.
Thank you so much for signing the proclamation, as you have always every year. And hopefully one year we will come here and declare that we won the victory on,
Right.
On heart
Exactly.
disease.
Exactly.
Unfortunately, it continues to be the #1 leader of causes of death, not only in St. Mary Parish in Louisiana, but in the nation.
Yes.
And you highlighted the things that we stress the most, and that is prevention, the things that people can do to help put themselves in a position to lower their risk.
Right.
one thing that is not mentioned in there, but certainly if you have a family history of heart disease, that too can also play a role. But that old prayer of serenity is always true. Control the things that you can control. And as you stated, smoking is probably the number one risk factor. Being a male over 50, African American males, and African American women actually are at higher risk. Controlling your blood pressure, maintaining a healthy diet, regular exercise, and controlling your diabetes, controlling your cholesterol. All those things can reduce the risk. February, as we all know, is also the time we celebrate Valentine's Day. So that was one of the reasons why I think February was considered Heart Awareness Month. But I want to just remind all the viewing audience that heart health is something that should be on everyone's calendar, not only in February, but every day of the year. Those of us who are Catholic, we're going to be going through the Lenten season. So take that opportunity. I know, a lot of folks make New Year's resolutions, and they call the third Friday Failure Friday because they've already, failed in that. But if you want to do something for Lent, I think it's a good time to do reflective. You get a second chance to take and do something to help yourself and your family. There are things that, again, can be treated. So I want to thank you again for always, signifying that. We do have resources in the community. I'll just make a shout out to the work that we're doing at Teche Action Clinic. We are ready to serve you. The Bayou Bend Hospital also has cardiac rehab right now. So those who may have a problem, if they need cardiac rehabilitation, we have that service available locally also.
Thank you so much, Doc.
Dr. Wilkes, you're talking about preventive care. For years we heard basically just watch your diet, do some exercising. Mm-hmm. But now there are more opportunities. You've got the Wellness Center here at Bayou Bend that you just mentioned. What are other steps that people can do for preventive maintenance or care?
Well, the things that I talked about earlier, we're hopefully, if we are blessed, we will be getting a pediatrician. So it actually starts out as a child. If a child can maintain a healthy weight, and we're screening kids now as early as, matter of fact, Tulane did a study called the Bogalusa Heart Study, where they started screening children as early as age 2, checking their cholesterol. And we found that if you can have a child have a healthy diet, healthy exercise, maintain a good weight, and carry those same health principles into adulthood, then that's going to also lead to prevention. But the things that I mentioned before, the other things people can do. You have a choice. You can have a choice on what you eat. You have a choice if a provider says you can have an exercise regimen, you can do that. Certainly primary prevention, never start smoking, and if you do, we have lots of products that can help you quit. Cholesterol, we have medications as well as diet. I always have to caution people because, when people come in, patients will come in and will say, well, Doc, I don't understand why my cholesterol is still high. I took my pill. Well, it doesn't give you a license to go eat a big seafood platter or a big hunk of meat, So diet has to be in hand with medication and exercise. But it can be beat, and we can win this war. We can win this war. What about prevention with seeing a doctor or a cardiologist? How often should they see one? Well, this instrument around my neck, the stethoscope, we always listen to people's heart. When we do that, we're actually listening to make sure if they have any valvular heart problems. It's one of the big things we listen to, as well as to determine if they have an enlarged heart. But an EKG is a standard. Anyone with hypertension, diabetes, high cholesterol, to get a baseline EKG. The EKG can give us some information in regards to the electrical activity in the heart and some of the things in there that we could tell if there might be a possibility of having ischemic heart disease, which is an interruption of the blood flow. A stress test is one of the standard tests we do. We put someone on a treadmill, do a continuous EKG. You can tell if there are defects where you might not be perfusing. We have coronary artery scoring calcium scoring, where you can have a CAT scan that picks up calcium deposits in the coronary arteries. But then sometimes, people have asymptomatic disease. That's why we call hypertension the silent killer. And there have been a lot of folks that thought they had bad indigestion, and they wound up, having a heart attack at home. So the classic, everyone remembers Fred Sanford from Sanford and Son, when he would grab his chest and say, "Hold on, I'm going to see Elizabeth." That is not the way chest pain presents a lot of times. It can present, with jaw pain. It can present with indigestion. It can present with just nausea, not feeling well. The classic chest pain that's squeezing like an elephant sitting on your chest, or, going down your arm, is not always the way it presents. So you have to have a high degree of suspicion. Any doubt that anyone may have, I think the best thing to do is to go ahead and get checked. Do not listen to your body. Your body will tell you, some of the symptoms that you need to be aware of. All right. Well, I'm going to tag team into our dental. I have another appointment.
All right. Okay.
All right.
Done.
All right. Okay.
All right.
All right.
So you're gonna be on
I'll
that
just put
side,
them on
on the
to
side
the-
down or what?
Yeah.
Yes.
Gonna slide down?
Yeah, we'll slide down.
He got it.
Right. Doc, all right, how you doing? All right.
100 up there.
Just a picture, yeah. Then he'll sign her.
Dr. Williams, how you doing, Mayor Foulcard?
Dr. Williams, you don't have to
My seat.
as long as I did, if you don't want to. But
Okay.
All right. All right, Will. Right. Okay, all right.
slip out this
All right, thank you, Doc.
Thank you.
All right, thank you so much. Okay, at this time, I'll proceed to read the proclamation on Children's Dental Health Month, and so happy that you're here, Dr. Williams. Whereas the future, to a large measure, dependent on good health of our families, whereas good oral health habits start in childhood, and we owe our children the opportunity to lead healthy and prosperous lives. Whereas good health can be achieved in part through good dental habits learned early and reinforced throughout life. Whereas a public educated about oral health is empowered to embrace healthy oral hygienes and dietary behaviors. Now, therefore, I, Eugene Foulcard, Mayor of the City of Franklin, hereby proclaim the month of February as Children's Dental Health Month. And I urge all the citizens and community organizations to join in this observation. In witness whereof, I set my hand and cause the seal of the City of Franklin to be affixed on the 5th day of February 2024. So at this time, I'll proceed to sign the proclamation for Children's Dental Health Month, and then I'll turn it over to Dr. Williams. All right, thank you so much.
Thank you,
Yes,
Mayor.
thank you.
Thank you for continuing the tradition of observing Children's Dental Health Month.
Yes.
It started in 1940 as a day.
Okay.
In 1981, it extended to an entire month. The 2024 theme for Children's Dental Health Month is healthy habits equal a healthy smile. Childhood tooth decay continues to be the most common chronic illness among our children. So if we practice healthy habits such as brushing our teeth twice a day with fluoride-containing toothpaste, cleaning between our teeth with floss, staying away from sugar-containing beverages, and eating nice, nutritious, healthy fruits and vegetables, and of course, come and see your dentist at least twice a year. Because we all know that oral health continues to overall health. Overall health continues to make good health for our entire families. Teche has been at the forefront of trying to address these needs with our school-based programs, our mobile dentistry, and of course our various sites throughout the state of Louisiana. So we're very thankful that you joined on board and to address children's dental health.
All right, thank you so much. we're blessed to continue this tradition of signing these two proclamations every year, and I would like to thank Dr. Wiltz and Dr. Williams and the staff of Teche Action Clinic of doing the great things that you continue to do within our community. So thank you very much.
Thank you.
Good deal. Did you want to get the staff in there?
Yes.
Yeah.